Have you ever felt uncomfortable, developed an itchy rash, or had an unusual immune response after devouring a delectable glass of milkshake or a plate of dairy-rich food, like a portion of cheesy pasta or a buttery cookie? But how can you determine whether you are experiencing dairy allergy symptoms, lactose intolerance, or something totally different? To put it simply, a dairy allergy develops when an individual's immune system reacts to one or more of the proteins present in animal milk. While cow milk is the most often consumed dairy product, these allergies can also be triggered by goat or sheep milk. This allergy appears to affect 2% to 3% of infants and often disappears by age 6, resulting in a prevalence of approximately 1%. However, adult allergies are typically chronic and persist throughout life. So, what is a dairy allergy? How is it different from lactose intolerance? And what are the major factors responsible for it? Stay tuned as we look at the 7 key signs that may prove you are allergic to milk or milk products, along with suitable dairy alternatives for your diet. Understanding the dairy allergy. A dairy allergy is a hostile immunological response to a dietary protein, essentially casein, which is found in milk curds, and whey, present in liquid part of milk, are the two parts of milk that can elicit an atypical immune response. It is possible that one or both of them could cause an allergic reaction. If you are allergic to cow's milk, you are likely also allergic to sheep's and goat's milk. Usually, allergic reactions occur shortly after consuming dairy products. When an individual with a dairy allergy consumes dairy products, the immune system reacts to a particular milk protein, either casein or whey, induces an immunological response, makes an effort to eliminate the protein. The immune system detects the protein the next time it comes in touch with the body. The body will react to the dairy protein by producing immunoglobulin E antibodies. When the body creates these antibodies, it releases histamines and other substances that cause an allergic reaction. This leads in allergy-related symptoms, such as a rash or difficulty breathing. There is also a population of individuals who suffer with eosinophilic esophagitis, a chronic inflammatory illness. In this instance, an allergy to animal's milk typically causes inflammation of the esophagus, a tube that connects the mouth to the stomach. Lactose intolerance versus dairy allergy. In some cases, a dairy allergy might mimic lactose intolerance and vice versa, but the two conditions are different. Technically speaking, lactose intolerance is not an allergy. It is not caused by an immune system reaction, but rather by the body's inability to digest lactose, a form of milk sugar. Typically, lactose intolerance affects digestive systems only after consuming milk or milk products, including cramps and pain in the abdomen, nausea, discomfort, and vomiting, bloating, gas, diarrhea. Also, lactose intolerance is more common in adults and tends to get worse as people get older. This is because, as you age, your body begins to manufacture less lactase, the enzyme required to successfully digest lactose. Therefore, even if you have consumed dairy products your entire life, you can acquire symptoms of lactose intolerance at any time. Signs of a dairy allergy. Now let's take a look at the 7 common signs of a dairy allergy. Number 1. Swelling and inflammation of the face and throat. Anaphylaxis is a severe, life-threatening allergic response that typically begins minutes after eating an allergen-containing food, but can also occur hours afterwards. It typically involves many symptoms in multiple parts of the body simultaneously. The symptoms appear abruptly and include hives or urticaria, a swollen and sore mouth or face, wheezing, short quick breaths, a rapid heartbeat, clammy skin, feeling anxiousness or confusion, dizzy spells, retching or nausea, pale or bluish lips, lightheadedness or loss of consciousness. Number 2. Rapid pulse, dizziness, fainting, or loss of consciousness. If you feel as though your heart is pounding or fluttering in your chest after consuming dairy, this is another possible indicator of anaphylaxis. In this situation, it is imperative to seek assistance quickly. Additionally, drowsiness or even fainting may suggest anaphylaxis. Again, immediately proceed to the emergency room or contact for emergency transport. Number 3. The appearance of hives on the skin. Another indication of a dairy allergy is a rash that can develop anywhere within a few minutes to 3 hours after exposure to dairy products. If you have hives, which look like a flush of red bumps on your face or body, along with other signs of a serious allergic reaction, like trouble breathing or problems with your lungs, you should see a doctor right away. Otherwise, make an appointment with a dermatologist to identify what may be causing your skin irritation. Regardless of the cause, the first-line treatment for hives is typically antihistamines, which inhibit the effects of the histamine causing the hives, or corticosteroids, which reduce inflammation. Number 4. Feeling nauseous, having diarrhea, or severe vomiting. When your digestive tract is inflamed because of a dairy allergy, you may get an upset stomach, throw up, or even have bloody stools. This can specifically affect infants and lead to severe diarrhea and vomiting. In case you have a baby who continues to vomit hours after consuming formula milk, you should take him or her to the doctor for an examination. Number 5. Eczema, acne, and other skin problems. Several studies now show that there is a link between acne and eating dairy. A dairy allergy can also cause a delayed reaction that shows up as eczema. Despite the need for additional research, those with chronic skin conditions typically report clearer skin after eliminating dairy from their diets. Number 6. Feeling tired or fatigued. Fatigue is a common sign of a dairy allergy. There are many other reasons for fatigue, like problems with your thyroid or hormonal imbalance. But if you've had a full medical checkup and still can't figure out why you're tired, you should talk to your doctor about the possibility of a dairy allergy or other food sensitivity. Number 7. Joint aches. Studies from as far back as 1986 have shown that an elimination diet can help joint pain and even rheumatoid arthritis. People who had joint pain and cut dairy out of their diets for good felt better, but those who went back to eating milk and other dairy products said their joint pain came back. Management and treatment options for dairy allergy. People who are allergic to dairy should not eat dairy products or foods that contain dairy. To avoid a severe reaction, you should take the following precautions. Number 1. Always check food ingredients before eating. Look at what's in the food. People who are allergic to dairy should read the labels on processed foods to make sure they don't eat anything with dairy in it. Milk proteins are often found in strange places, like some chewing gums, salad dressing, breads, other baked goods, and more. Ingredients like whey, casein, and anything with the prefix LAC contain milk proteins that may cause an allergic reaction in some people. Number 2. Inquire about food preparation. Ask about how the food was made. When eating out or in a restaurant, people should ask about the food's ingredients and how it was made. Number 3. Take antihistamines in case of an allergic reaction. If the allergic reaction is minor, antihistamines available over the counter may be sufficient to alleviate the symptoms. Number 4. Carry epinephrine at all times. Some people who have a more severe reaction to dairy may need to give themselves an epinephrine injection. People who have more serious reactions should always have an epinephrine with them. Alternatives to dairy. People who are allergic to dairy may also be allergic to other foods made from animals, like goat milk, or from plants, like soy milk. People can buy a lot of plant-based alternatives to cow milk, such as soy milk, almond milk, and milk made from other nuts, rice milk, hemp milk, oat milk, coconut milk. Human breast milk is also a good choice for babies younger than 1 year old who haven't started eating whole foods yet. But if human breast milk is not an option, there are other things that can be done, like using soy protein formula, as it won't cause allergies. Also, babies can sometimes have an allergic reaction to breast milk if the parent who is feeding them has dairy. If this happens, or if their baby is allergic to dairy, parents may want to talk to a doctor about the best alternative formula. Risk factors and complications. There are some key factors that may enhance an individual's probability of having a dairy allergy. These are 1. Age. According to research, about 7% of babies younger than 1 year old have an allergy to dairy. 2. Family history. People with a family history of allergies are 3 times more likely to have allergies. 3. Breastfeeding for less time. Babies who are breastfed for less time are more likely to get the allergy. Research from 2017 shows that babies who keep drinking breast milk are less likely to get allergies. 4. Other allergies. If a child has other allergies, he or she may also get eczema or asthma, which are also allergic conditions. 5. Giving food to babies before 4 months. Babies who eat foods before they are 4 months old are more likely to get an allergy than babies who are only breastfed until they are 6 months old or older. Summary: people who are allergic to dairy can live normal lives. To avoid an allergic reaction, they will need to stay away from milk products and foods that contain dairy proteins. Many children outgrow dairy allergies as they get older, but most allergies in adults don't go away as they get older. This means that an adult with a dairy allergy will probably have it for the rest of their lives. Because of this, these people should talk to their doctors about coming up with a plan. In case they have anaphylaxis, a severe reaction, it is important for these people to know how to use injectable epinephrine. With that, we come to the end of our video. We hope that you benefited from this video. If you did, please hit the like button and share the video with your friends and family. Want to see more videos like this one? Please subscribe to our channel, Welcome to Wellness, and press that bell icon as well, so you never miss another video. We'll see you in another healthy video. Until then, take care.